Hello and welcome. This is Dr. Gerard Cuomo. I am live here at my Boca Raton office going through another rescue case. This particular rescue has to do with an anterior bridge that evidently failed, and now we have fractured abutment screws that are lodged into place. No one else has gone in on this case, so there's no prior access or prior attempts from another dentist. So this is a classic case where now we have more than likely mobile fragments that will be relatively straightforward to remove. We'll see. So right now I've been busy with just a diode laser. We've been at it for about an hour now with just a diode laser, and we're able to uncover utilizing soft tissue laser to uncover each of the fragments. So this is what you're seeing now live. If you go to the LinkedIn channel under my name, you'll actually be able to see this case with the photographs taken. All right, so first things first, we're going to go in. We've been pre-soaking, we actually been pre-soaking this case with an assortment of items. Number one, let me go over to the table. I'll show you these items. Here we have tartar and stain remover. We have a little bit of machine oil from Handpieces, which is a real clean, very, very good penetrating oil. And then, of course, for any drilling, we use Crisco shortening, which works really well. We borrow that idea from the tool and die makers, the experts at machine milling. Okay. Give a little shout out here to Charles Matchabich, who also does rescuing work over in the California area. So we're both in this devotion for our patients. And right now, we're going to go ahead now and use something called a microsuction. So that we borrow from the endodontist, some of their tools. Certainly you'll see some. I'm going to go now with the microscope. We're now moving toward 5 power. So this is how we'll do just the idea. Now we'll take out the fluid that's in there, and that will uncover both screws now. These screw fragments actually are a little bit above the first thread, which is a nice place to be. There's a leading fracture edge. If you look really closely, you'll see it in the 6 o'clock position. And I'm going to switch mirrors now. I'm going to go with my other mirror. And this one's a little heavy. It's a 2.5-inch mirror. Now we're going to switch to a smaller mirror. A little better control here. There we go. Now I'm up to 12.5 power right now. And you can actually see the serial number on the inside of the implant. We're looking for any fracture lines, any wear and tear that happened or occurred in what we call the conical connection area, or the area where the implant abutment surface interfaces with that of the fixture itself. And so now I'm going to test the screw fracture for mobility. We're going to go toward my right, which is a reverse. And we're finding out that, yes, we do have some mobility, so that's good news. So this one tests well for mobility, and we can almost start to spin it out. Now I'm in the 12 o'clock position, so this is the best time. Let me just stop and talk a little bit about, what happens to the GP when they first look at this and they're saying, okay, I can get that out of there with an Explorer. Wonderful news. That's the best method. If you find that it doesn't move, pre-soaking it and waiting a little longer, you'll be able to get that to move. If not, if you're in a hurry and you decide to use a Cavitron, or what we call an ultrasonic scaler, or any piezoelectric as well, you're risking it all. It is like rolling the dice. And trust me, once you abrade the rim in here, you've locked it in. Now, I've just recently rescued a case. I'm going to put that up on my LinkedIn channel as well. But dentists, please listen closely, that it's so important to be able to soak these fragments first and give them a chance to get loose, and then you can use your Explorer to get them out. All right, so I know I can get this one out, no problem. That's got mobility. We'll have it out in a jiffy. Let's check the other one that's been also pre-soaked. And I say pre-soak, I'd like to tell you that I take a micro brush, and I really like to do this. I'll dip it a little bit in the oil. This is the handpiece oil. And then a little bit in the tartar and stain. Now you're good to go. You got the two together. You bring it in, and we just put that right in place like this. Slowly put it in place, and then go back and dip again. And again, what you're doing is you're adding 1 drop, 2 drops, 3 drops. Finally, and you look at your tip, and if it looks discolored, you want to get rid of it, because we've already been soaking these, so my tip isn't discolored right now, but sometimes they turn almost black. That's because it's this bioburden material that we've learned to acknowledge. So yeah, it's bioburden. It could be a number of things, including bacteria in there. So now we're going to use the suction device again. Again, this is our micro suction. You can see if you look really closely, I'm going to try to magnify that. You see how gray that is? So that's the solution that gets cloudy in there, but it's because it's dissolving what's on the wall of the fixture itself. So it's going and it's penetrating past. Even with the suction tip now, you can see if there's any rotation. If not, we'll soak it a little longer. We'll work on the other one. Okay, so let's see if there's been any movement. Now it's in a 9 o'clock position. That's the leading fracture part of the thread. And because no one's been in there, we're able to see that and recognize it. We want to preserve that. And let's see if we have any mobility. Okay, so this one we're going to soak a little longer. Minor mobility here, just a little bit, not enough to move it, but it's there. Oh, you see it moved. Okay, so we'll soak this one a little longer while we're working on the other one. So that's the A, B's, and C's. I hope this helps. And if you learned anything today, do not use any ultrasonics whatsoever. It's just condemning the screw fragment. You're making it more difficult for the guys like myself and Charlie out there in California to rescue. And our patient's just itching his nose a little bit here. Okay, here you go. All right, so I'm going to pick this up in the next video, but right now it's just all Explorer, backing it out gently, and then we'll use a smaller suction tip to get it out on the screen. And then I'll show you what these all look like. Dr. Gerard Cuomo, we'll catch you on the next video here in my Boca Raton office. Thanks for watching.